Hello and welcome to today's Here's to Your Health podcast. I'm your host, Don Linsman, and my guest on the podcast today is Tammy Hulsing. Tammy is a speech language pathologist here at CCMH, and Tammy, thank you for joining me today.
Yes.
You're one of our newest staff members, and so welcome aboard. We appreciate your being here. Tell us a little bit more about who you are and your education experience, where you come from.
Great. Yeah, Monday was my first day, and I'm super excited to be here, but I'm not completely new. I've been coming to Crawford County 2 days a week. I came from St. Anthony Hospital. That's where I've been the last 11 years prior to this. But I started my career actually in healthcare as well. When I came out of the University of Lincoln, Nebraska with my master's degree, I started with Donna DeShaw, who was one of the very first speech language pathologists to ever provide speech services in the healthcare setting.
Wow.
So I worked for her, and then I transitioned to the schools, and I worked in the school setting for about 15 years and worked primarily with birth to 5-year-old children. Mainly late talkers, children with autism, children with severe developmental disabilities, things like that. So learned a ton in those first years, and then transitioned back to the healthcare setting in St. Anthony Hospital for the last 11. And I've served everywhere from kids all the way up through nursing home patients. And
wow.
I started my career that way, and I'm still doing that.
So this is not your first rodeo, is what you're saying?
No,
okay.
No.
So let's talk a little bit about speech pathology. Obviously, I need to come see you for a little bit. Speech pathology, why it's important, and where these speech issues arise. So let's talk about that right at the very beginning. Let's talk about maybe some instances where people might need speech pathology. Maybe it's really evident, and sometimes maybe it's not quite so much to them, but maybe you've got better insight on that.
Right. People automatically think about trouble speaking when you say speech therapy. So that's what people automatically think of. I can't get my words out clearly. People don't understand what I'm saying. But it's so much more. That is part of what I do, but it's so much more than that. It's not just being able to speak, it's being able to understand what people are saying to you, being able to remember things. So we work with memory, we work with comprehension of language, we work with voice, being able to have a clear, loud enough voice to be heard. We work on, of course, the articulation and the speech clarity. And what people really don't think about is swallowing. A big portion of how I spend my week is working with people on swallowing. And there's a variety of reasons in all ages for swallowing difficulty.
Well, May is Better Speech and Hearing Month, and I know that part of a lot, so maybe not part, but a majority, much of what happens in healthcare, when we start talking about people who have difficulty communicating or understanding what's being communicated with them, can really affect their health. And I'll use older adults as an example, where if you have hearing issues, it affects your speech, but that affects so many things that they think that's a precursor to dementia, which I think is a very interesting thing. So what you're telling me is that speech pathology actually can help in those situations.
Absolutely. We have to be able to socialize to keep our mental health. All kinds of mental health, from memory deficits to depression to social isolation, mental illness. Communication and ability to socialize with others is a huge part of that. So when we're not able to hear, that reduces our ability to interact. When we're not able to understand what others are saying, or when we're embarrassed that we're not speaking clearly or understanding what others are saying or know what to say in response, we just avoid those situations.
So you probably work then a fair amount with people who are in the audiology department who can help people to hear.
We went to school together.
Okay.
So when you go to undergraduate, you don't declare whether you're going to be a speech pathologist or an audiologist. It's not until you get to your master's degree program that you separate. So yeah, we do work closely together. Yes.
So the background is very similar. That's interesting to me. I did not know that before today.
Yeah.
My guest on the podcast today is Tammy Hulsing. Tammy is a speech language pathologist, and she just began her career with CCMH, but she's been doing lots of things over the years. Tammy, what's your favorite age group to work with? Is there one?
Oh, no, not really. I mean, I've always enjoyed elderly, and I've always enjoyed children and everything in between. So I really don't have a favorite population, but through the years, I've worked hard on developing my skills with voice and with swallowing particularly. I've got a special place in my heart for people with head and neck cancer. That is a very growing population right now, and it's a new area for us as speech language pathologists, and I've really dedicated the last few years of my career to learning everything I can about that, and it's very rewarding to be able to help that population in a very difficult time. So I think that's what I love the most, is working with people who are going through a difficult time, whether it be medically or emotionally, and helping them in some way, shape, or form make that easier.
So there are a couple of questions that I want to ask, but I think I'm going to ask this one first. How are people diagnosed in a way that they say you need to see a speech pathologist? How does that diagnosis come about? And are there symptoms that maybe as lay people we can identify when it comes to that?
Absolutely. Absolutely. Changes in voice, frequent throat clearing, coughing, people who are avoiding conversations or stay out of conversations for a variety of reasons. People who may ask you to repeat frequently. If you have a loved one who you noticed is asking you to repeat more often than normal, or if they're throat clearing more often, or they seem to have changed the way they eat a little bit. Those are flags that we often miss, I think.
In your opinion, what's the most challenging case you've ever had, or the most challenging condition maybe that you face when people come to see you? What's the thing that when they walk in the door you go, this is going to be interesting?
I don't even know where to begin with that. There's so much. I mean, from the little kids who will hide in the corner and not talk to me at all the first time, and the parents are so embarrassed because they want their child to perform for you, and I'm like, it's okay. It may take 3 or 4 sessions before they warm up, but we can still do things in the meantime. So kids have their own set of challenges. Adults who maybe it takes a while to pull out of them what's wrong. Everything's fine. Adults tend to be everything's fine. So it's really lots of questions and probing to figure out what really their concerns are sometimes. But I think that's the part of my job I love so much, is problem solving through and figuring out a way to help people, no matter what it is.
So maybe the flip side of that is maybe one of your best successes.
I think when I have those 2-year-olds that come to me that aren't talking and the parents are highly concerned, and then in just a short period of time we can make a big difference, and the parents are coming back saying, oh my gosh, they said this, or they said, we were on the phone with grandma last night and they said this, and that's just really heartwarming. And when I see parents literally years down the road when their kid's graduating and they say, oh, hi, and they turn to their kid, you remember Tammy? And they're like, no. And I thought, that's a success. They don't remember me. They don't remember speech therapy. That's perfect. Because they're fine now. And then the adult whose family, even though they're going through such a tough time, they remember me in the community too. And they say, hey, you worked with my dad. I remember seeing you in the hospital and you helped so much. And that's why I keep coming to work every day.
My guest on the podcast today is Tammy Hulsing. Tammy is a speech language pathologist here at CCMH. We're talking about Better Speech and Hearing Month, and specifically her work as a speech pathologist. You're saying that kind of gives me that desire to ask this sort of follow-up question. You probably do see people at their worst sometimes, just because of the nature. It can be so frustrating to not be able to communicate adequately, and it has to be extremely rewarding to be able to help people to do that.
Yes, absolutely. Yeah. When your loved one's in the hospital, you're stressed. you're stressed and you're looking for those people who can make it just a little easier. Or when you're that parent so worried about your kid and I don't want to send them to preschool because they're not talking. No, we can help. We can help.
Tammy, I'm sure that there are people out there today wondering if they can just give you a call to schedule an appointment or if they need a referral. What say you?
I would say if you have any questions, you can always call the rehab department here at the hospital and ask for speech therapy, and I'll walk you through what needs to happen. I'll answer some questions on the phone to get us started to see if you're on the edge. Do I come in? Do I not come in? Just call and talk to me. But yes, we do need a doctor's referral in order to bill your insurance.
And the best place probably to start is whoever your primary care provider might happen to be.
Yes, yeah. Just talking to them about your concerns, letting them know.
Okay, very good. I wish I had more questions today, but I'm sure we're going to have another podcast at some point in the future, so I'll save them until then. But I really do appreciate your time. Thank you so much for being with us today.
Great, thank you.
My guest on the podcast today is Tammy Hulsing. Tammy is a speech language pathologist here at CCMH. We were talking about Better Speech and Hearing Month. If you have any questions about speech pathology and how it might be able to help you or someone in your family, you can either contact your primary care provider. If they're here at CCMH, you can call 265-2700. Or if you'd like to talk to Tammy, you can call our main switchboard. That's 712-265-2500. And they will make sure that they connect you with her. I'm your host for the Here's to Your Health podcast, Don Lintzman. Have a great day. Thank you for listening.